One who doesn't have a digital presence is or a digital address is like a refugee. You don't have any state. So you got to have your digital presence across multiple platforms. But I guess the thing is to say yes to everything, yes to all the opportunities that come your way, and then evaluate. So you got to do a lot of surgeries in the beginning, and you should not lose out on a surgery for the sake of price. So in the beginning, a person should be ready to operate for free also.
Wonderful, sir. The 1,000-day rule is, very useful tip, I guess. What are the biggest mistakes that you made with the first few months of practice that you would like to change or advise your youngsters not to make?
I can't remember of any mistakes that I
Okay.
made. I guess not having enough patience in your decisions. You don't switch hospitals quickly unless you realize that you made a grave decision, grave wrong decision. Have patience with your clinics and your hospitals to build a patient base. Don't be very fidgety or very hasty in switching your jobs. Everything takes time. Our practice to build up takes time. For a patient to trust a surgeon takes time. When that trusted patient tells another patient, then that patient gets converted to a surgery more easily. So have patience in your place of work, be it the corporate hospital or be it the clinic. That is one thing. And the ABC of success in private practice is: A is availability, B is behavior, C is competence. A is availability. You got to be in the same place at the same time after 5 years also. You operate a bimalar fracture and his friend has an ACL, and 5 years later he remembers, oh, Dr. Vinay sits in Mahalakshmi layout, let's go catch him. You should be there in Mahalakshmi layout after 5 years. So A is availability, first thing. Next is B is behavior. You got to treat your patients well verbally. You got to talk to them well. You got to understand them properly. Okay, so the third is competence. Once all these two are there, then competence comes into effect. No, even if you're the greatest surgeon in the world, if you're not sitting in one place for a long period of time, people can't find you. If you sit in one place, you don't talk well to patients, behavior is not there, again, you'll not succeed. Competence comes in the end. Competence is very important. Competence is what we are building all these years. Okay, by fellowship after fellowship, fellowship after fellowship. But patients don't recognize competence unless they lie on the surgical table under your knife. For that to happen, you got to have the A and B. So have the A and B, and have patience, uh, and you will succeed. We all will succeed. We're all orthopedic surgeons. I think orthopedic surgeons are the ones who are listening to this podcast. If you're an orthopedic surgeon, you already quite done quite well in your MBBS to get a PG seat and to clear this. So we'll all do well in life. No need to get disheartened by a few days of having less number of patients or a few months of having lesser number of surgeries. We'll all do well. So have patience, I guess. That is something that I would advise young surgeons, and that is a mistake that they should not do in the beginning.
Okay, that's relieving for most of them. Actually, you answered most of our next question also, because the next question was what drives the patient's trust. That was our next question. And we
Yeah.
were willing to give the options like skill, communication, and consistency. And you named it very clearly, like availability, behavior, and then comes the skill part. So the next thing is how to approach pricing. That's a very sensitive part. So how to approach that and the availability and patient communication when building your brand.
I think we are a very price sensitive market in India.
Mm-hmm.
Be it the car that we buy to the surgery we opt. Okay, we are not very price sensitive when we are spending on things that gives us joy, like watching a movie. And even spending a car was a wrong example for that. Sorry, you're buying a luxury car that gives you joy. Okay, in our part of the world, undergoing healthcare service is not a part of having joy. It is a sorrowful experience. So people are very miserly in that. They don't want to spend on that. They'll spend on expensive cars and shirt, but they don't want to spend on healthcare. There are two phases of a surgeon's career. I'm thinking that I'm in the second phase now. Phase one is where you want to build practice. Okay. If you see 100 OPDs also, still a patient may not remember you as fondly as a person you operated on. A person you operated on will remember you all your life, and provided you've done a good job on him, of course. So you got to do a lot of surgeries in the beginning, and you should not lose out on a surgery for the sake of price. So in the beginning, a person should be ready to operate for free also. I was in a government medical college, in my Bangalore Medical College, where we didn't have an arthroscopy set at that time. I invested on my arthroscopy set. I never used to charge my patients for that. And I used to do surgeries there. That is how I acquired my skills. If I had not invested, and I would not have taken that step, I would not have learned so much. So you got to be ready to cut down on your profits or price in the beginning of your career to do more number of surgeries so that you acquire more skills, so that more patients know you. Then comes a certain stage of your career. I spoke to a diabetologist of my mother. So he told me, boy, there'll be a day where you'll be waiting for patients, and then there comes a day where you'll be saying that no more, enough. I'm done with these patients for today. No more patients. That stage also will come. So at that stage, where you have a family, where you have reached a certain level, then you feel that if I'm putting this much effort, I need to get this much remuneration after a certain case. Then you set a price point. I think I'm at that place where I don't mind losing one case, where if I'm doing a case, then I expect a certain remuneration. So I don't mind losing. So I've set a certain remuneration for a certain case mentally, and I don't mind losing a patient if I don't get that remuneration. But in the beginning, one should try to do as many surgeries and as possible. And our patients are all price sensitive, so you should try to keep the price as low as possible, especially for our cash patients and all, because they're paying from their own pocket. They're not very well off. So try to help them as much as possible with your surgeries, and your remuneration should be lasting in the beginning of your career.
That's a loud and clear message, sir. So, in private practice, how do you maintain ethics, and what are the ethics that you reinforce to your younger colleagues to maintain?
First and the most important thing is do no harm. Uh, that is the thing that is taught from the beginning. That is what we all have to follow, be it in private practice or elsewhere. So if there is a surgery or a treatment that is going to benefit the patient only, then do that. Always keep yourself in the patient's shoes and think from their perspective. Would I do this upon myself, or would I do this upon my kid? Then only do those things on the patient. We start that from the Hippocratic oath to every day. The moral things that we follow is you got to do only surgery or treatment that is beneficial for the patient. If you do that, then there's no reason why you should break away from ethics and do something which is not so ethical. And if you develop enough number of patients, you will have plenty of surgeries. You don't have to run behind the number of surgeries. So if you don't do things ethically, it might work the wrong way also. That's one. If you do 10 surgeries also, that does not spread your word so much, that a bad surgery does a bad marketing for you. So you do one bad surgery or one surgery which is not so required, your name is spread very badly in the market, and you lose a lot of patients. So I guess ethics is something which we all have to follow, and which I'm sure a lot of our brethren are doing. I don't think ethics are in question at all. But sometimes the older surgeons question us younger surgeons whether it's required. They still believe that ACL surgery is not required in every case, as as an athlete would require. So there are various schools of thought, but ethics is something which you have to follow, whether you're in a government medical college or a private medical college or in corporate practice. That will keep you steady over a long period of time. You can't cut corners on that.
And the next thing is, we know that you are involved in many startups, and we need to get your guidance for the young surgeons on what are the things they should look out when they start on this entrepreneurship.
I'm not in many startups. I'm only in one startup, and even I didn't start that up. I got absorbed into the startup. I was a consultant with them. It's called Mad VR. We design virtual reality for orthopedics. Mad VR is medically applied designing for virtual reality. One of my friend is a co-founder there, and he was using my expertise to build a knee replacement module. And none of the other four co-founders at that stage were doctors. So I got an offer from them saying that we don't have any doctors on board. Our credibility will get a big boost if we have a doctor in the founders. So I said yes. I guess the thing is to say yes to everything, yes to all the opportunities that come your way, and then evaluate. Okay, don't hold back. You will get a lot of opportunities. If you keep saying no or think too much about a certain thing, you'll lose out on a lot of opportunities. Keep saying yes to everything that comes, and keep reevaluating and evaluating yourself. If something is not working, a decision X is not working, then you go back on the decision and do something else. So opportunities do present to all of us. It's all about accepting and going ahead with that. I got that opportunity that day, and I said yes. uh, and it's going well. We are company is valued at around 36 cr right now, and I hold around 5%, 5.5% share in the company, and we're doing quite well. Opportunities will come from industry, from your friends, and if there is a niche idea and you do a research and you find that it is something that the world or the market requires, then you should start working on that. And there are a lot of educational tools that will help you into planning your startup, taking it forwards, and all that. You can get it incubated by a lot of firms, and they'll guide you, they'll handhold you, and take you forwards from there.
So next is the burning question for many of us. Many of us are already using social media very well. What is your advice regarding the digital presence for young surgeons? When should they start? Should they start as early as residency, or should they wait till their practice picks up? And what sort of contents do you think are bringing us patients, or building a clean digital image for us?
One who doesn't have a digital presence is or a digital address is like a refugee. You don't have any state, so you got to have your digital presence across multiple platforms, social media, and YouTube. A lot of times your hospital does it for you, and the scale that your hospital can do uh, is not something which you can easily match, because the funding that they have is a lot compared to what you can put in for your social media marketing. But you should start with something. uh, there was Google My Business earlier. Google My Business is integrated with Google Maps now. First thing is to have your clinic on Google Maps. Google Maps has a subsidiary called Google My Business. Have that, and without any promotion, Google sends you a lot of patients, and a lot of surgical and a lot of footfalls are because of Google. It's very important to maintain a good Google hygiene. That means get reviews, reply to the reviews, reply to the negative reviews. That is more important. If there's an unhappy patient, you got to reply to those reviews. Google takes that seriously, and keep posting photos, videos in Google My Business. Then the other platforms are LinkedIn, Facebook, Instagram, and YouTube is a separate market. We can't do all this, so it's no harm or no shame in hiring someone to help you out with all these. I have a social media manager whom I pay a remuneration of around 20,000 per month, and he maintains a lot of these for me. But you should also be aware of what actually works. Uh, and digital presence is mandatory across the platforms.
Okay, sir. Thank you. Like you have various phases, like you present, you teach, you remain academically active, yet you run a full private practice. What is the driving force for the academic commitments you have, and what role did these conferences, writing, and networking play in shaping your career?
I guess we are all into academics because of our role models. My role model is Dr. David Rajan in arthroscopy. and our teachers in post graduation. And the word doctor comes from teacher. It literally means teacher. So you are a teacher, and you are a student also all your life, and you are a teacher also all your life. So if you the opportunity presents, then you got to keep teaching maybe your juniors, and you can have fellows at a later point in time. It keeps you honest also. If you're just doing a surgery, and sometimes you make mistake, if X person is watching, then you are more careful. So that way, we all would like to train our juniors, and pass our skills on to the next generation also. That's how most of us who come into practice after 5 6 years, we start our own fellowship. It helps our practice also, and it keeps you educated also. They teach you something, you pick up something from them. So it's very important to remain up to date. It is also said that the technology is evolving so much that 50% of your practice will change every 5 years. So if you're not up to date there, then you'll lag behind the rest of the world. So you got to attend conferences, you got to be academically active to stay up to date with the present changing technology.
Wonderful, sir. That's a very valid point. But it's highly possible that we get lost in all these. But what are your non-negotiables in a typical week? Do you read a journal per week, or watch an educational video per week? How do you keep up?
Okay, you give me two options there. Read a journal or watch an educational video. A non-negotiable should be sleep. That is the most important root cause for all chronic ailments and ill health is lack of sleep. Even I suffer from that. Sometimes I get 4 hours, 5 hours, but at least I make sure that my Sunday is non-negotiable. I sometimes silence my phone and switch off all my alarms and sleep on a Saturday night, so that I get 8 hours, 9 hours sleep on a Saturday night at least. So sleep definitely is non-negotiable. At least one workout in a week. I would like to work out every day if that is possible, but at least Sunday is one day where I definitely would like to work out whatever it is. I might go for a swim, I might go for a long run, or go to tennis with my daughter, something like that. I guess not everything is academics. Not orthopedics is not our life. Not orthopedics is not everything in life. So I guess sleep and exercise are two non-negotiables in a typical week.
Wonderful answer, sir.
So, we also want to know from you, what are the three biggest illusions young surgeons have about a private practice?
There's a lot of mistrust about corporate hospitals that I also had personally. That if you go to a corporate hospital, there'll be a lot of targets and you'll be under a lot of pressure. That is an illusion. There's a fear of the corporate system of hospital work amongst youngsters, which I also had before I came into corporate. Frankly, it is not there at all. The biggest tip I would like to uh, give to someone who's taking up a corporate job is don't go for a very high salary. If you go for a very high salary, you got to justify that salary. Go for a moderate salary or a slightly lesser salary so that you can justify that billing. So that is one thing. A fear of corporate hospitals, that a corporate job is never safe, is something that youngsters have, which is so far away from the truth that it can't be anything else but that. You never see a doctor being fired by a corporate hospital. We rarely see that. Doctors move from X hospital to Y hospital to Z hospital because they have a better opportunity there. So for a corporate, if there is an established doctor, if they lose him, they have targets. They don't give targets to doctors as such, but they have targets. So their targets will become more difficult to achieve if a doctor leaves suddenly. So mistrust of corporate hospitals and is quite common amongst youngsters. I guess you should not have that. 90% of patients come to private doctors in our society. So that is 90% of the workforce. So that is something which you should not have. Corporates are not like that. Corporates are not behind money all the time. They are businesses. They want to make business money, but it's not exorbitant that they're looking for. So corporates are a great place to work. You finances are not an issue there. That is one thing. Don't have fear of joining a corporate. I'm in a corporate, and it's not bad at all. You can do good ethical practice in almost every corporate. That is one thing. Second is, again, it comes back to patience. Don't imagine yourself that you'll be doing 100 surgeries in a month on day one. Have patience. Practice takes time to build. For a patient to develop a trust on a doctor, it takes time. No one believes black hairs. You got to gray a few hairs, only then patients start coming. So you got to put in those hard years, then practice develops. So that is one thing. We don't run behind a quick buck. That is the second illusion, that you'll make a lot of money. And money is not something what we practice for. We'll never make as much money as you know uh, a contractor who lays a road. A contractor who lays a road would make crores of money in that. So money is not why we are here. Money is not why we took up MBBS after plus two, 10 plus two. So money is not what we should be after. At the end of the day, if you come back after a good day's work and you feel satisfied with what you've done all day long, that is what you should aim for. So a lot of money is another illusion that youngsters have, which they should not have. Money is not why we are here, and money is not why what we should be behind.
Thank you, sir. Message is loud and clear, and we are coming to the closing part of the podcast as well. Some of your answers were, most of your answers were very frank and practical, and I guess it will be very useful for young surgeons like us starting out private practice. So the last part will be a little bit of fun part, a rapid fire round, where you should, answer the questions in seconds. So the first question is going to be academic clinic day or surgery day, which gives you more joy?
Surgery day.
Okay.
You don't see blood for a few days, you'll feel itchy. Yes,
Okay,
surgery
sir. So the next one, only
amazing.
one answer, nothing, or just a word. That's it.
Yeah.
So the next thing, one gadget that has genuinely changed your practice.
Mobile phone,
Okay.
Okay, the next question is one habit that keeps you sane during busy weeks.
keeping myself calm.
Yeah,
Maybe,
That's
yeah.
also a habit.
If you have one extra hour per day, where do you dedicate it? Like for clinic, for family, for workout, for sleep?
Can I choose two?
Only one.
Workout and family.
Workout and family. Okay.
so if you had to do only one surgery for the rest of your life, which one will it be?
I don't know, trauma maybe, because every trauma is different. Every ACL is the same. I can't do that for all my life. Every rotator cuff is somewhere around there and thereabouts. Every Bankart and remplissage is there and thereabouts. I get, having the experience of doing so many ACLs now, I guess I can't, every trauma will be different. So maybe
Okay.
trauma, because there'll
Okay.
be variety there.
Wow, you have betrayed all the arthroscopy surgeons out there.
So ask me a question. I can't be doing only ACL all my life. I'll get bored. I'm already bored of
Yeah.
ACLs.
Yeah. Anything that's different and keeps you challenging gets you more occupied. Yes. Totally agreed.
Wonderful, sir. Thank you for spending some time out of your busy schedule coming here and answering all our questions.
A pleasure was mine. Thank you so much. Final message to all the young orthopedic surgeons who are listening. You are orthopedic surgeon. You should be proud of that. That means you already achieved something, and you are destined for great things. There are challenges there, but we are quite sure that you will overcome all of them, and all of you will do well in your lives. All of us will do surgically well. All of us will do financially well in life. So don't be overwhelmed by the situation. I have never seen a doctor who's not able to feed his family, or who's not able to balance the needs of his family. Everyone does well. So you're on that side of the fence. You sitting there, you're wondering, will I do well in this big world? Will definitely do well. The fact that you're an orthopedic surgeon means that you're already something, and you will definitely do well. Keep doing the right things for a long period of time. Orthopedic practice or any clinical practice is a marathon. You got to run for a very long time steadily. So keep that momentum, keep that direction going. Don't falter there. Good luck.